The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. We have another great show for you today. Today we'll be talking about the open enrollment period for Medicare, which starts October 15th and runs through December 7th. You'll be able to evaluate your plan, is it meeting your needs, and you can look at other plans that might better meet your needs. But we'll also be talking about COVID, particularly in relation to Medicare, how that's changing to better meet your needs, so stay tuned.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
If the Aging Network in Montana was a restaurant, the sign out front would say, over 50 million meals served over the last 30 years. Since adequate nutrition is critical to health and quality of life, nutrition services are an important factor in keeping older Montanans healthy, independent, and living in their community and home. To find out more about senior nutrition programs in your area, call 1-800-551-3191.
Final call from like 566.
Hello, gentlemen. May I see your Montana Real IDs?
IDs? Why, I'm Captain Meriwether Lewis.
And I'm Captain William Clark.
Hang on, I see more than one William Clark.
It's the real me, I promise.
Discover more at mtrealid.gov. Available now.
Montana Real ID. It's the real me.
And me.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Hi folks, and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. As I mentioned earlier, we'll be talking about Medicare and you, and we'll be talking about how the COVID is affecting Medicare and how it's changing to meet your needs. But we're going to start with open enrollment. Open enrollment happens every year. It's from October 15th through December 7th. And of course, we have our wonderful guest here again, Kimmy Everman, your special projects with Department of Public Health and Human Services. And let's talk about open enrollment. What is that, and why is it important that it happens every year?
Well, okay, let's just back up for one step and say the basics of Medicare are A, B, C, and D. So you've got those pieces. Yeah. And the thing about your pieces of Medicare is that you can choose a lot of how those services are delivered to you. So open enrollment is a time annually when folks who are on Medicare get a chance to say, the plan I had last year worked great and I want to do it again, or the plan that I had last year wasn't so great, I'd like to try this other one. And that's very simplistic, because anybody who's had to sign up for Medicare knows it's a little harder than that. But it's an annual time for a person to be sure that what their benefits are giving to them are what they need. They're the best cost for what that person is getting, and just, are they happy with their services? Yeah.
Well, now, Kimmy, the two variables in Medicare which you can choose to meeting your plan, meeting your needs, is that's Medicare C and Medicare D. Right. Those are two variables that you look at. Right. Tell us what those are and how they might be changing, or how you want to reevaluate if they're meeting your needs.
Right. Well, Part C is actually referred to as Medicare Health plans. They're also Medicare Advantage plans. That's maybe what more people know them by. And Part C is a mixture of A and B, and A is your hospital, B is your outpatient.
And those are static and defined by Medicare. They don't
Exactly,
change.
that's exactly right. And that happens when you take the traditional model. So if you're the original or traditional, that's how it's going to look for you. Okay, so Part C then is a whole nother way of getting your Medicare. Instead of getting A and B, you go to a private company who you still are a Medicare beneficiary, but these private companies offer these plans, Part C plans. They have the A and the B in them. They also have the D. The D is the prescription piece that really is probably one of the most important parts of open enrollment is your prescription drug coverage. So the Advantage plans are even more of a one-stop shop where, as I said, you have the A and B and D. So when open enrollment time comes, you're going to look for a Part D plan if you have A and B. Maybe you have a supplement, or you're going to say, I think I'd like a Medicare health plan, Medicare Advantage plan, Part C, because it has everything that I want in one stop. So two very major ways of a person to get their services and then to decide about every year.
Yeah. And the Medicare Part D is Medicare prescription drugs.
Right.
And what are the variables in there that one wants to evaluate? What are the considerations to see if the D plan is meeting your needs?
Right. Well, are all the meds that you take on the list, number one. Number two, is the premium affordable for you? Obviously, we could all use a cheaper premium, but is it affordable for you? And be honest with yourself. Is there a deductible? Because not all the plans for Part D have deductibles. Some do, some don't. Can you get your medication, for instance, mail order? Maybe you don't want to have to come into town to get your meds. Maybe you want mail order. Not every plan has that. Many do. So you're looking at those kinds of things and making sure and knowing, one of the questions we get all the time as SHIP counselors is, but what if I get a new medication during the year that I didn't think about? Well, every one of the plans that's available covers 212 drug classes at least. That means if you get a new medication in that year, it's going to be on the list somewhere. Now, it may not be the least expensive, and maybe next year you're going to want a different plan for that, but you will always be able to cover
that. And it sounds a little bit complicated, but we have people that can help out.
SHIP counselors.
And computer programs or websites that you can put your drugs in and find out whether they'll be covered.
Exactly.
Tell us more about
Medicare.gov. It's got something called the Plan Finder, and we've been using the Plan Finder for years. It's gotten better and better and better. You put your medications in, some information about where you live and yourself, and push submit, and what comes back to you then are plans that are good for you based on the information you put in.
And it's up to you to choose what you want. Now, you can talk to a counselor. The counselor won't choose for you, but they'll advise you, or
they certainly
point you in
will,
that direction.
and they'll just support you through the process. It can be a little overwhelming and confusing. They will support you through it. They've done it many times with many folks, and they really know their stuff.
They know their stuff, and it's important to know that these individuals are in your community. You can meet with them in person. You can call the number on the screen. You can go to the website, but they don't have anything on the shelf to sell you. Their only interest is to make sure that you get the plan that is best for you at this point in time. Now, we'll be talking a lot more about Medicare, the different plans, but we'll also be talking about, in the age of COVID, how is Medicare changing to better meet your needs and your physician's needs? We'll talk about that in the next segment, so stay tuned.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, but my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Montana's fighting COVID-19, and if we want to stay open, we should all listen to the experts and mask up, especially when we can't social distance.
We want our students in class and sports back this fall, but we've got work to do. One proven path to slow COVID-19 is to mask up.
We're wearing our masks.
And our players are too.
I'm wearing my mask to protect you.
Will you wear yours to protect me?
Mask up, Montana.
Welcome back to Aging Horizons. I'm your host, Brian Lamore. In our last segment, we were talking about individuals that can help you figure out Medicare. Now that we're at the open enrollment period, which starts October 15th through December 7th, there might be still some questions. So, Kimmy, let's talk more about our SHIP people, the people with the 800 number that can help our listeners out.
Sure. First of all, we'll run the number on the screen so that people have plenty of chances to write that down. But we have SHIP counselors, State Health Insurance Assistance Program counselors, who are specifically trained in just all kinds of Medicare minutia, which is awesome because that's what you need when you're, trying to answer lots of questions. And they are in all of our area agencies on aging. As you have said many times here, Brian, they are objective. They're not being paid by any particular drug company to give you, a little push towards anything. No, they're only there to help you make your own decision by helping you with knowledge and education.
Well, now, Kimmy, to help our SHIP counselors out, what are some suggestions? I call up and it's like, should I have something ready?
Yes.
I mean, what would the first questions a SHIP counselor would say? Okay, I'd like to help you. This is what I need from you.
Right. Usually, if you've got a Medicare card with your plans on it, and I don't mean your Medicare card. I mean your cards from there you go. From your health plan, so that person can help you figure out. Because I was at the drugstore the other day, and a gentleman in front of me had his health care card, but he didn't have his little Part D card, and he had he had a terrible time trying to understand what that person needed, and so that's a place where a SHIP counselor can help you keep track of that kind of thing and tell you what's the difference between all of those cards that we have to carry around. They're going to fit individually to what you need. That's how they're going to give you information. That's how they're going to assist you. They're going to keep it confidential, and they're going to fit to your unique situation. And that's the kind of assistance and education that you're going to get from a SHIP counselor.
You probably also want maybe your drug bottles that you're taking.
Absolutely.
So that you can quote the correct drugs.
Yes. And we do say too that if it's possible around open enrollment time to get a printout from your pharmacy, just what's written down correctly. And then you can there's no question, because we don't want any mistakes with dosages or anything like that.
Exactly.
But yeah, so you want your meds, you want your, and in that case, you do want your Medicare card in case there's something going on that you need to talk about. And if you're getting into your re-enrollment of your drug plan, where do you want to pick it up? Do you want to go to Walmart? Do you want sent by the mail? All these different kinds of decisions that you're going to have to live with for the next year.
Okay, when we talk about living for the next year, we're in the age of COVID right now. It's going to be around for quite a while. We're talking Medicare, and we have, I'll say, an endangered or a susceptible population, age 60 plus, going to a health provider where people aren't well, but they have a thing called telemedicine, and Medicare is moving towards that, which is a great help. What is telemedicine? How is that helping our seniors?
Well, I think it's helping not only our seniors, but our adults with disabilities, and just plain anybody who feels safer at home right now, which is totally okay, than going out into the world. Telemedicine is, one of the things that the Centers for Medicare and Medicaid Services has done is 135 of the services that they provide are now covered under the telemedicine list, and I guess what I mean is that they're able to bill for telemedicine in 135 areas of Medicare, which is fabulous because there's got to be one of those that you're probably trying to do, and we're talking about mental health visits. We're talking about just doctor visits. I've got a cold or a headache. We're talking about pharmacy management. I need to have somebody check in with my meds on a regular basis. All these things, even ER visits can potentially be done over telemedicine. So I think the expansion of that by Centers for Medicare and Medicaid Services is awesome. And of course, we still want to do our masking and our washing of our hands. I mean, I think we all carry a bottle of hand sanitizer with us anymore. I know I do. Social distancing, and just remember that all those things you're doing to protect others. That makes you a hero.
Oh, yeah. Yeah, and it protects you too, because you protect yourself, you protect the others, and hopefully then this will be behind us. But it's great that we have telemedicine, and I think there's still some few questions we have about that we'll probably discuss in our next segment, because we're running low on time here. But it's important to know that we do have people throughout the state. They're called SHIP counselors that can assist you with anything in addressing Medicare. We also have some programs that are available to help you pay for Medicare, and we'll talk about those in the next segment too. But the same people, the SHIP people, are the ones that can help you with that eligibility. And they have some other programs that you might be eligible for too once you contact them at the number or at the website that we have. We have a lot of great information, so stay tuned. We'll be right back.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
I was outside working on some equipment, nothing too strenuous. I started sweating and feeling out of breath.
When he felt pressure in his chest and aching in his arms, I knew we had to call 911.
First responders were there before we knew it. 38 minutes later, the doctors had restored the blood flow to my heart.
Now we know dialing 911 saved his life.
Your life is on the line.
This message sponsored by Mission Lifeline Montana.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we'll continue our discussion about Medicare, particularly telemedicine. And Kimmy, we still have a couple issues that are up in the air on that from the last segment.
Yeah.
Tell us more.
Well, I wanted to mention, Brian, that many of the expanded services under Medicare that are now telemedicine services, Medicare is looking to make those permanent, to make that a permanent piece of the benefits that a person gets. And why that's so important is that prior to our pandemic, telemedicine was not nearly as big and strong as it is, 6 months into it or 8 months into it. And Medicare, as I've always said, can be very, very proactive, and they saw the need to have an option for, as you said, some of these vulnerable folks who can get sick just going to the doctor's office, much less get well, that having the option to do a telemedicine appointment and have it covered, Medicare sees the value to this, I think, as we all do. And so that's really good news.
And when we were talking earlier about what to bring to your SHIP counselors meeting, we said, I said, you bring your prescriptions, but we've got a little twist on that.
Yeah, we do. And this is one way that if you want to cut down on the work, see a SHIP counselor, because once they put your medication list into the database, that Medicare.gov that I was talking about, or the plan finder that I was talking about, it saves it for you, and then next year when you come back to look at your plans again, that SHIP counselor can pull that up, and you can say, well, I still take A, B, and C, I don't take D or F. And you don't even have to worry about having a printed list or all your medication bottles or anything like that. So they've made it very, very easy. The other thing, and this is always an issue for me, I lose my passwords. I've got passwords for everything. And one of the things about the mymedicare.gov, where you can go to use the plan finder and to have your drug list, is one, it's confidential and secure, and if you lose your website or your password, they'll help you get another one without it being a huge hassle. And I really like that. I think that's a good service.
Well, now, give me, you're saying you got your password and you got to do this, but what if you don't have all them fancy machines, smartphones, computers? You might not have internet, but we do have a solution for that too.
Yeah, we still have landlines.
Yes.
And you can still call our 1-800 number on your landline and get to one of our area agencies on aging, and they can get you the person to talk to, who can not only help you with your Medicare, but what else might you need? Do you need Meals on Wheels? Do you need a respite? Do is there anything else that is a need in your life that there's a possibility some help for? And so it doesn't matter if you don't have a computer. Call up. The SHIP counselor will have a computer.
Yes.
So they can deal with that part if you don't.
And they're part of the area agencies on aging, which are designed to meet the needs of seniors and disabled, age 60 plus. And there's some other conditions there too. But but they're there to help you in any aspect of aging.
That's right.
But now, we're talking about Medicare and the money, and we have some special programs. They're called helping programs. There's 3 or 4 of them, and they all have different eligibilities.
Right.
So you need to talk to your SHIP counselor.
Exactly.
But tell us more about how they can help our viewer.
Well, I think that these are probably some of the most important things that we talk about, because not everybody can make ends meet as easily as others. So we have some programs that will help with your Medicare. The first is called Medicare Savings Program, or MSP, because we like our acronyms at the state. But the Medicare Savings Program helps a person pay for their Medicare Part B. So that's that outpatient
B as in boy.
B as in boy. And it might pay premiums, deductibles, other out-of-pocket costs. It all depends on where you fit on that eligibility scale you were talking about. So if you want to find out if, who couldn't use another $150 in their checking account every month? If you're eligible for Medicare Savings Program, they'll pay the premium for you. So there's a really good one. The next one would be the low-income subsidy, and that is specific to Part D, as in dog or drug. So the drug piece of our Medicare, we have a low-income subsidy, or it's also called extra help. And that, again, pays for premiums, deductibles, and other out-of-pocket costs. And there are different levels to that assistance. So you may get, if you maybe you have a little bit more in terms of income, maybe you'll still be eligible. You can't know till you find out.
Right.
So you want to ask the SHIP counselor. And then finally, the Big SkyRx program, which is a homegrown program. It's for folks that maybe are making a titch more money and don't really ever are never eligible for other things, and can get that, and it'll pay for their premium every month. So 3 great helping programs. Call your SHIP counselor.
And it's important to know that you've been paying into these programs for your taxes,
this is a
through your
hand
employment.
Up.
Yep.
Not a handout.
And you're eligible, and it's your right to be eligible.
Right.
It's not
That's
not
right.
welfare.
That's right. Absolutely, Brian. We make no judgments. And again, as you have said so many times, our SHIP counselors are objective. They have nothing to sell you. They only want you to make your best choice.
And they want you to make sure you got the right programs at the right time to help save you money and to bring services to you that makes aging a lot better. We have a lot of issues when we grow older, and they kind of stack up at times, but sometimes they can be resolved, they can be helped. We can take away a lot of worry by contacting a SHIP counselor and getting some assistance and counseling that we need. For Aging Horizons, I'm Brian Lamore. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.